terminal ileum. Next. So causes is exact causes unknown, like the genetic, immune system dysfunction, and environmental trigger associated with NOD2, CAR15 gene mutation. So in symptoms is abdominal pain, diarrhea, weight loss, and obstruction due to scarring, and skip lesson, normal bowel between diseases segment, chronic relapsing course. And treatment is anti-inflammatory, drug, corticosteroid, and immunosuppressant biology, and surgery bowel section. So this is the string sign na nagpakita nga nipis nga ni us-us nga intestine nga makita sa X-ray. So kini siya is tungod sa inflammation o scarring of the bowel. Ang string sign isa sa importante nga timailhan nga gigamit sa pag-diagnose sa Crohn's disease. So kani siya kaning gamay nga string. Ana siya ang string sign. Next is ang sa image A sa taas, sa left side is usa ka small bowel study nga nagpakita nga skip area. So naa siya adunay nga mga parte nga normal o adunay pod nga naay mga sakit. So ang sa image na B is usa ka spot image na nagpakita nga linear ulceration. And sa image C is usa ka endoscopic image nga nag-form adunay mga ulceration or samad-samad na sulod sa bowel wall. Appendicitis. So appendicitis is the inflammation of the vermiform appendix using a cause by an obstruction such as fecality, hardness, mass of stool, or in rare cases, a neoplasm. Tumor is the most common abdominal surgery emergency in the United States. Is causes: fecality obstruction, neoplasm, bacterial infection, and sa symptoms naman is initial pain around umbilicus migrate to right lower quadrant, and nausea, vomiting, and low-grade fever, and elevated WBC count. And treatment is surgical removal, antibiotic from infection control, and emergency surgery. Ulcerative colitis is a chronic inflammatory disease of the colonic mucosa lining of the large intestine. The exact cause is unknown, but it is believed to be autoimmune disorder, where the body immune system attacks its own intestinal lining. So next is causes is exact cause unknown, and genetic predisposition, and sa symptoms is bloody diarrhea with pus and mucus, and abdomen pumping, fatigue, weight loss, and complication, toxic megacolon, bowel perforation, and colon cancer. And treatment is modification, steroid and anti-inflammatory drugs, and surgery. Next. So, esophageal varices. So, esophageal varices are abnormally dilated, located in esophagus caused by increased pressure in the portal venous system. They are similar to varicose vein found in the leg but occur in the esophagus due to portal hypertension. So muni ang sa small intestine. So muni siya ang skip area. And large intestine is munay makuanan sa Crohn's disease. So let's move on and read. So this is image A is esophagus reveal serpentine filling defect indicating esophageal varices. And this image B is stomach cardia shows similar defect indicating gastric varices. So causes is portal hypertension, cirrhosis of the liver, and the symptoms is rupture and hemoglobin, vomiting blood, low blood pressure, and fainting, sign of liver disease such as jaundice of acids. And treatment is endoscopic and bad ligation, vasopressin infusion, and balloon tamponade and transjugular and intraocular.
So, let's proceed to the degenerative disease. First is the herniation. Hernia is a protrusion of a loop of bowel through a small opening, usually in the abdominal wall, also referred to as a rupture. So as we all know, rupture occurs because of the weakness of an anatomy. Then there are types of herniation. First is the inguinal hernia, which is common in men. It occurs when a bowel loop protrudes through a weakness in the inguinal ring and na siya'y chance nga mo descend downward to the scrotum of the man. The second type of herniation is the femoral and umbilical herniations, which occurs in both sexes, which means nga dili ra ang lalaki ang maka-experience of hernia, which is ang babae po na ay chances. Next is types of herniated loop of bowel. So first is reducible. If a herniated loop of bowel can be pushed back into the abdominal cavity. So ang pasamot sa reducible is if ang herniated loop of bowel is bago pa siya, napa siya'y chance nga mo balik sa iyang normal na position. The next is the incarcerated hernia. If it becomes stuck, it cannot be reduced. So ang incarcerated hernia is if ang loop is dugay na siya nagstay sa inana nga position or dugay na siya na herniate, which means lisod na siya ibalik sa ihang normal nga position, which mag-need na ka og surgery ana, but the blood can still pass ani nga obstruction. Next is the strangulated hernia. If the constriction through which the bowel loop has passed is tight enough to cut off blood supply to the bowel. So ang strangulated hernia is na totally obstructed na ang way. So bisag ang blood kay dili na siya maka-pass through, which makalid pud siya into bowel ischemia. Next is the hiatal hernia. Hiatal hernia is a weakness of the esophageal hiatus that permits some portions of the stomach to herniate into the thoracic cavity. It occurs about half of the population over the age of 50 years. So, sa hiatal hernia is ang imong esophageal hiatus kay niabot na siya sa thoracic cavity. But again, sa akong gaingon din ha, kung early stages pa sa hiatal hernia, which is reducible